Shaflo Sharipova feeds her 18-year-old autistic son Ayub lunch. 8 people and 3 generations live in this apartment unit. It feels even smaller since construction crews tore out the balconies last year.
Majority of our buildings overcrowded with the children, so many families have 3+ children in family. And majority families are extended, so they live there with their parents, so we have lots of seniors in this building. So those families, yes, they were struggling.
A doctor in Tajikistan, she's emerged as a community leader here during this pandemic.
Okay, hi everyone, assalamu alaikum.
Helping feed families, encouraging people to get tested for COVID-19 and dealing with the repercussions of isolation.
I know maybe 2 families from where women experienced domestic violence and they moved to shelter.
At a nearby warehouse, a new food bank delivery service. When pandemic closures began in March, people lost their jobs, which were often in the service industry or gig economy.
So there was a significant loss of income that hit the community that was already struggling with poverty. So we heard there was a need for food.
For those who continue to work, crowded housing puts them at higher risk of infecting others. So health authorities and community groups quickly realized to avert an outbreak disaster, they'd need to bring testing to Thorncliffe Park.
If we can get a better sense of the actual numbers in this community, we can ensure that there isn't a large outbreak that impacts the community severely.
So far, Thorncliffe Park has avoided that large outbreak, though the rate of infection is still higher than nearby neighborhoods. A lot still isn't known about treating or preventing COVID-19, but there's now little doubt about who's among the most susceptible. Vic Adopia, CBC News, Toronto.